However, I find meal replacements for our big people very good, do work well. So this is a German study where you're on a conventional diet, don't lose much weight, and then you go to 1 meal replacement a day and do reasonably. If you start with 2 meal replacement drinks a day and 1 normal meal, and then 1 meal replacement, you can maintain weight loss for years. And we're using these meal replacements. So I have a clinic for a BMI greater than 55, Friday mornings, and the first thing they'd come in is they see the doctor, then they go to a group, and then they're started on meal replacements. And it works remarkably well. And one of our insurance companies did it, and they put people on 2 meal replacements for 16 weeks. The end of the year, 7% of overall weight loss, and in those with diabetes a bit less. Do you think they continued the program? Only 6% weight loss. Yes or no? I wouldn't be showing you this if it didn't work. So they continued it because there were cost reductions and hospitalisations for those with diabetes, 35% the first year, due to less vascular events. So they work, even short term. And then there's the direct trial. Have you seen this one? This is from Glasgow and Newcastle on Tyne, where people with diabetes for less than 5 years were put on meal replacements. And the aim was to get them to lose 15% of their weight. And this is sort of the outline. So this is the group who've done it, and they've gone from 102 to 88 kilos. And they're watching these people who stopped at various phases to see what happens. And there's the control group who stayed pretty well. And this is, and I blame Mike Lean for these slides, they're terrible. But if you lost more than 15% of your weight, 86% of the diabetes went into remission. Right? If you lost 5 to 10% of your weight, 34% of your diabetes went into remission. They're out to 3 years now, and they're going out to 5, right? And that's a major cost saving, both to the individual and to the system. And the other thing about it is it can be reintroduced. If weight goes up, see, this is treating obesity as a chronic disease. If things start to get worse, you increase the treatment, go back to what worked before, or yeah. So what were we doing? We know that 11% of the patients in hospital are known to have diabetes. When we've done an audit, a quarter of the patients in hospital for surgery, whatever, not have diabetes. And we're going to screen everyone with admission. We're going to triage them. And new diabetes are going to get the very low energy diet, the meal replacement program. So to get rid of their diabetes. This is our metabolic rehab clinic. We couldn't call it the obesity clinic because people don't like that, but that's why they am. But this is at Concord Hospital, and they exercise, they sit around, and this is their first lot. This is what convinced the hospital to keep it going. The people lost weight and their hemoglobin A1C came down, and the cost of the clinic was met by the cost of drug reductions. And we've done 4-year follow-up in a few, and most patients overall, they lose 26% of their weight in the first year. Doesn't matter really very much what the operation is. If you have diabetes, this is insulin treated before and after, though we've still got a lot we're chasing up to find out what it is, but it works. Surgery works. And these are my hospital's operations. As you can see, we've done some people up here around 250 kilos and some people down here about 80 or 90. And they lose weight pretty well, about 30 kilos overall. And in general, except for this one, they keep it pretty well off. So it is effective so long as you have a program and follow-up.